If you're turning 65, you've probably received a flood of phone calls, mail, and information trying to get you to sign up for Medicare. You've probably heard terms like Medicare Part A, B, C, and D, Medicare Supplement, Medicare Advantage, Plan A, Plan F, Plan G, and unfortunately, it's way more complicated than I think it should be. But the good news is that if you learn it in the right order, it can actually boil down pretty simply. So that's what we're going to go over in this video today. Specifically, I'm going to explain when you need to enroll or sign up for Medicare, what the different parts of Medicare are, what they cover, the two main ways you can set up your coverage, and how to know what plan fits you best. I'm Andrew Donaldson. I've been working as an insurance broker licensed with Medicare for about a decade now. I live in Utah, but I am licensed in multiple states. So with that, let's begin. Most people become eligible for Medicare at age 65. You have a 7-month window called your initial enrollment period that starts 3 months before the month you turn 65, the month of, and 3 months after. During that 7-month window, you can sign up for Medicare. Now, when I say Medicare here, I'm referring to Part A and Part B. That's what's referred to as Original Medicare. And you'll get a card directly from the government. It's red, white, and blue. It'll say your name on it, as well as your Medicare ID number and your Part A and your Part B start date. If you're already taking Social Security benefits when you turn 65, you'll probably be automatically enrolled into A and B of Medicare. If you're still working or your spouse is still working and you have healthcare coverage through that employer, you have the option to delay your Medicare. Now, there are some specific rules around this. For example, COBRA does not count as creditable coverage where you could delay your Medicare with no penalties. For some people, it's better to start Part A but delay Part B, and for others, it's better to delay both A and B. So the first question you need to answer is, should you start Medicare now or should you delay it? You have the option if you have other coverage through the employer. I would start by talking to the employer to figure out what type of coverage you have, how that works with Medicare, and compare it to what coverage you can get on Medicare to see which one's a better fit for you. I'm happy to meet with you to go over your specific situations if you have further questions. Now let's look at what Medicare actually covers. Part A is hospital insurance. A good way to think about this is Part A covers the buildings and Part B covers the people. Part A covers things like inpatient hospital care, skilled nursing facilities, but it also covers things like hospice care and some home health care. Most people do not have a premium that they pay monthly for Part A because they have worked 10 years and paid taxes to Medicare or 40 credits with Social Security. Part B is the medical coverage. That covers the people, your doctors, your specialists, your outpatient procedures, preventative services, lab testing, as well as certain medications that are administered in a medical setting. Part B does have a monthly premium that you'll pay, and it typically will be automatically deducted from your Social Security check. In 2026, the standard rate is $202.50, and it can go up from there if you have a higher income. Now, while Original Medicare is the foundation, it doesn't cover everything completely. It does have deductibles for A and B that do change yearly, and after your deductibles are met, you'll have a co-insurance of typically 20%, meaning Medicare will cover 80%, you'll cover 20%. There are also some things Medicare doesn't cover, like routine dental care, vision care, hearing, non-emergency transportation, as well as prescription drug coverage. So this brings us to the two different ways you can set up your Medicare. While A and B are Original Medicare through the government, Part C and Part D of Medicare are through private companies that contract with the government. Let's start with Part C, or Medicare Advantage. These are private insurance companies that get funding from Medicare when you choose to enroll in their plan. Typically, these have to cover at least comparable coverage to what you get through Medicare Part A and Part B, but it will come with a doctor network, a maximum out of pocket, and a standard list of copays and co-insurance for different services. However, oftentimes these plans will include things like dental coverage, vision coverage, hearing coverage, maybe transportation benefits, and a maximum out of pocket. Alternatively, if you don't want to deal with a doctor network at all, you can keep Original Medicare as your primary coverage, and you can buy a separate standalone Part D drug plan to just cover your prescriptions. If you're worried about the financial risk, of having no maximum out of pocket, you can buy a secondary policy called a Medicare Supplement or Medigap policy, where you pay an extra premium every month to have them cover your 20% co-insurance. The Medicare Supplement route gives you the freedom to see any provider who takes original Medicare, as well as have predictable costs, knowing that you have basically a fixed premium you pay every month and your medical expense will be fully covered. The downside to this is they don't cover things that original Medicare doesn't cover, like dental, vision, or hearing. The other important piece to understand about Medicare supplements are you can't just enroll in a Medicare supplement at any time, because they can look at your pre-existing conditions or medical history and either raise your premiums or just deny you into the plan completely. But when you're new to Medicare, you have a 6-month window from the time you start Part A and B together, or the time you start Part B, where you have guaranteed acceptance, meaning no matter what your pre-existing conditions are, you can pick a Medicare supplement plan and be approved and enter their plan at their premium rate. To boil it down, a Medicare supplement is going to have higher monthly premium costs, much lower or predictable costs when receiving health care, broader access to medical providers, separate coverage for your drugs, as well as no coverage for dental, vision, or hearing. Medicare Advantage or Medicare Part C is going to have lower monthly premiums, co-payments as you use your health care, an annual maximum out of pocket that your co-payments count toward, provider networks and plan rules you must follow, as well as your drug coverage and other coverages like dental, vision, hearing just bundled into the plan. Oftentimes these are HMO or PPO plans. You can go to Medicare.gov, put in your zip code, and look at Part C plans, Part D plans, and supplement plans, and compare coverage options for yourself. Neither path is automatically better for everyone. The right choice is going to depend on your doctors, your health, your financial situation, and your preferences. So before picking a plan, I recommend asking yourself a few questions. What are the doctors and hospitals I want to make sure I have access to? What are the drugs that I'm going to make sure I need covered? Do I travel a lot, or do I just need coverage in the service area where I live? Would I rather pay a little bit more predictably, or pay a little bit less up front, but a little bit more if I need health care? And finally, are dental, vision, and hearing going to be concerns that I want covered, or do I need to financially budget for those out of pocket? So your simple Medicare checklist should be: first, determine when you need to sign up for Medicare so that you don't miss your guaranteed acceptance window and you don't go without coverage and get penalized. Second, apply for Part A and Part B through Social Security, or confirm that it's been automatically done for you. You can easily do this if you have an online account, or if you communicate with Social Security through mail or phone ahead of time. Next, get a list of your doctors and meds together, and then you can compare your Medicare options, whether you go with a Medicare Supplement, Original Medicare, or a Medicare Part C Advantage plan. Make sure you do choose your coverage before your desired effective date. Medicare always starts on the first of a month. So if you choose to start a supplement plan, apply for Medicare, or start a Part C plan, it's going to start on the first of the following month. And finally, know your deadlines. If you're in Medicare Advantage, every year from October 15th through December 7th, there will be Medicare open enrollment where the Medicare Part C plans will change, and you can either choose to stay with your current plan or switch to a different plan or go back to Original Medicare. This is typically where you'll see the telemarketers, TV ads, and mail flooding you, trying to get you to sign up with them for their Medicare plan. As a licensed independent insurance broker, I have clients with a variety of health plans, and my job is to keep them happy so that I can be their agent for the long term. As agents, we make money residually. So the longer a client stays with me, the more money I make. So my goal is to keep long-term clients. If you're approaching 65 and deciding whether you should sign up for Medicare or stay with your employer coverage, I'd love to book a call with you to look at your specific situation, because unfortunately there's no way to make a simple video breaking that down. It is complicated. I hope that this video gave you a basic understanding of what your options are. If you found this useful, please like and comment or share this. It really helps the channel. And if you have further questions about your situation, my booking link is in my bio on my channel or in the description below. Thanks again.